hardest part of caregiving is often the fear that you're going to hurt someone you love. And if anyone's ever been a caregiver, they've probably had that moment. It only takes one moment for everything to change. This is one of the biggest fears that people have when it comes to caregiving, and we want to help you get through this. We have Dr. Tim Guiden, who is a doctorate of physical therapy, and he is the COO of First Settlement Physical Therapy. Tim, you have lots of experience helping older people and caregivers navigate through this, correct?
I do. I've been practicing for a long time. We have a lot of physical therapists in the company, and we see people from all ages, but the biggest bulk of our population are our elderly patients.
We are going to talk about aging effects, how aging changes movement and skin, common mistakes that caregivers give and how we can prevent those, safe techniques, so transfer methods and helpful equipment, and then caregiver health, because that is just as important to protect yourself as it is to protect your loved one.
Why does this matter? Why are we talking about this? There's some statistics on the screen there that are very important. Falls are very common, right? That 1 in 4 is something that you'll see across the spectrum. Everybody pretty much agrees on that. Even beyond that, about 41,000 deaths a year occur as a result of falls. Something like 3.5 million ER visits, $100 billion spent on falls. And those other 2 points on the screen really go hand in hand with that, right? So we're talking about falls. These falls are happening. They have devastating consequences. Skin tears, for example, 100% preventable. That's not something that needs to happen. And in terms of the falls, untrained caregivers might be contributing some to that, a lot to that. So we're going to talk today about some training, some tips, some tricks to try and reduce that 1 in 4. We want to cut down on that. We want to cut down on those 41,000 deaths, 3.6 million ER visits, and $100 billion. We're going to start turning that corner today.
I love this empowerment of helping people. I had no idea the statistics were that high.
Yeah. So let's start at the basics, understanding why are so many people having issues when there's a fall. If I fall down today, I don't have these same issues. So why in the elderly population are these occurring? Some things to think about. We've got muscle loss up there. From the age of 30 on, we lose roughly 5 to 10% of our muscle mass every decade. So if we think about our 60-year-olds, our 70-year-olds, our 80-year-olds, our 90-year-olds, we've lost a substantial amount of muscle mass. Joint stiffness, I don't bend over as far as I did when I was a teenager, right? By the time I'm 70, I don't know how much mobility I'm going to have. Limited range of motion is a real thing that affects our balance. We call it our center of mass. If our center of mass moves too far, we fall. So that limited range of motion is a real issue to deal with. Skin thinning as we age. One of the normal physiological things that happens is our skin becomes more thin. We all know that. It gets more like a paper consistency, so it does tear easier. It's not as resilient. Doesn't bounce back. A lot of our elderly patients and friends and family, they're on blood thinners. That doesn't help. And then that balance issues in the bottom right corner, a lot of what we talked about plays into it, but there's more too. Our vision doesn't do well when we age, so depth perception can be off. Common conditions like Parkinson's or even just normal aging, where our brain thinks we are in space isn't always where we are in space. So sometimes our friends or family, they think they're standing straight up and we're looking at them and they're leaning back pretty significantly. That's making them a risk to lose their balance. And it's something we got to talk about and you've got to get used to and know how to combat, because you can't just say straighten up. They think they're straight. We know they're not. So how do we fix that? And those are some things we're going to cover in this. So let's start talking about some of the specific common mistakes or risks involving our friends, our family, our patients. That one in the top left corner is a big one. We just all instinctively want to help grab someone by the arm. We shake hands. That's just like a common instinctual thing that we go for. When you're older and you've lost the muscle mass we've talked about, you can't pull someone's body weight by that arm anymore. I've seen shoulder dislocations. More detailed term might be a subluxation, where the arm doesn't come out of the socket, but it does get looser in there. That happens. I won't say regular, but it's almost regularly. We cannot pull on people's arms. That's a huge no-no. It's not the best way to do it, and it certainly puts them at risk. It's hard to have a biggest impact on these 4, but that's probably it. I'm going to scoot down to wrong footwear next, because this is such an easy one, and this is so common. I watch out for my grandmother-in-law. I had to hide some of her favorite shoes. No one needs to be wearing sandals around the house. It's a trip hazard. It's a fall risk. Good shoe wear is very important. So what does that mean? It means no stocking feet. If you're wearing socks and socks only, grippy socks exist for a reason. They're out there, they're cheap, they're easy to find. Grippy socks are way better than just plain old regular socks. Open-toed shoes, like I said with my grandmother, open-toed shoes are a disaster waiting to happen. Now, there are some better ones out there that do fit tight. If you hear someone walking down the hall and you hear slap, 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 that flip-flop is dangerous. That sandal is dangerous. It should be staying on their foot. Otherwise, it's a fall risk, okay? Laced up shoes, Velcro shoes, slip-on shoes can be good as long as they just fit snugly. But what contacts the ground is important. It should be anti-slip. It shouldn't skid or move around. It's a very easy one, but it's huge. And this means going through the closet, looking around the house, putting them in a box and putting them up in the attic. Give them away. Get rid of them. If you leave them, they're probably going to find them. So look around and get rid of those shoes that pose a hazard. It's just too easy to not address that one. We're going to talk a little more later about gait belts and what you might actually want to grip onto. But there's no reason to trust that maybe our open hand that we're assisting on whatever body part, are we paying 100% attention, or are we going to be a millisecond too late if something starts to happen? Poor grip is a real thing. If you don't have my hand already on the belt, for example, then I might not squeeze in time to help prevent someone from a fall. Or your grip, maybe it's on the wrist. We don't want to do that. You could tug the arm if that person loses their balance. You could pull on the skin and create a skin tear like we've talked about. So where your hands are matters. It matters. Cluttered spaces is another easy one. One of the first things I do when I'm doing a fall risk assessment or talking to someone about that is I look at the home space if I can, or I at least get a picture of the home space by talking to the person. Throw rugs, gone. Coffee tables that don't serve a really important purpose, gone. Getting rid of trip hazards, even when they're like emotionally near and dear, is so worth it. One fall you prevent makes it totally worth it. You want clear lines of sight where that person is going to walk. We shouldn't be expecting them to navigate an obstacle course to get to the bathroom or the kitchen or something. There should be room for a caregiver to be next to that person. We want room for our assisted devices. If someone's using a cane or a walker, maybe a wheelchair, we need room for all that stuff to operate appropriately. And the things I usually see are cords, rugs, or low furniture with corners. Tables, coffee tables, end tables, and sometimes pets. Where are you putting the pet stuff? Where's the food bowl? Where's the water bowl? If it is somewhere, if I'm washing dishes at the sink, if I'm imagining that I'm our patient or our family member that we're watching out for, we're doing the caregiving for, then if I'm standing at the sink trying to do some work, some activities of daily living, and that setup is behind me, I'm at a pretty big risk that might create a fall for me. So those are the main things that I usually look for in terms of decreasing trip hazards. And it's all very easy, right? It's just like the shoe wear. Preventative measures are so worthwhile. A little bit of work up front will save possibly disastrous consequences down the road.
So Tim, what do we do if an injury does happen?
Let's take them one at a time. So with skin tears, these are going to happen. It's not if, it's what happens when it happens. What do we do? Clean it gently. Like it says, a lot of folks like to have those little saline spray bottles or, having just a little bag of stuff around the house with maybe some antibiotic or Neosporin. Gauze is a great one. I always like to keep a roll of gauze. Band-Aids don't cut it when we're talking about elders. So my recommendation is you want to clean it, right? If it's a skin tear, then we don't want dirt and germs and things like that to stay on there. So very gently cleaning it, trying not to let the edges of the skin tear get bigger, right? So don't scrub at it and make it worse. Just give it a little spritz with the saline or like a betadine or something that you have. And then I usually like a little triple antibiotic or Neosporin, and then a layer of gauze I really like, and a little bit of paper tape to hold it in place. You're not bandaging it up so that no one looks at it for a week. This is something that you want to look at. You want to keep it clean daily. But if it is a deep skin tear, if it won't stop bleeding and stuff like that, then you're going to obviously want to get this person into their doctor, into their physician. But what you want to watch for as you're cleaning it is don't make the skin tear worse, right? Don't use a tape that when you peel it off, it's going to take more skin with it. And that's why I like just a little bit of paper tape on gauze, for example. After you've cleaned it, that's a good way to let it start to heal. Falls are a little more scary sometimes. The first thing up there is stay calm, and everyone feeds off of how you're reacting. That's important. and should go without saying, but take a breath, look at the situation. That's the first step. Sometimes that person is moving their body around while they're on the ground and they're not in tremendous pain. They look okay, and you can calm them down. Maybe we sit up, everyone gathers themselves, and then you get some help, and maybe you can stand that person up. But it's not a given that that's what you do, right? If someone falls, there's a chance that they've hurt something, that they've broken a hip, that they've broken one of their backbones or a neck bone. Those things happen, and those folks should not be moved without a professional there. Calling the squad for a fall is a really common reason they get calls, and there's a reason. They assess the folks, they make sure that they don't need a backboard or to splint the leg before they move the person. So you do not move somebody unless you're confident that nothing was hurt or like their life is in danger. If someone's sitting in a puddle of water and there's electricity around or something, obviously we got bigger fish to fry. But you stay calm, you calm the person down, and the first thing to do is figure out as best you can if they're able to be moved. If they can move their leg up and down, then they move the other leg up and down, nothing hurts, they're able to move, then okay, get some help and let's try and gently stand them up. If there's any concern, err on the side of caution. You call 911 and get the squad there. They are experts at that, and they are there for a reason. There's not a good reason to not get some help. Go get a neighbor, get a friend or family member, get some help. As far as prevention, it is always very important, whether it's a skin tear or a fall, to reflect on what happened for a second and figure out how it can only happen this one time. So how'd the skin tear happen? Did they scrape their arm on a door? I see that a lot. Okay, maybe we need to pad that door frame, or maybe we need to put a clapper on so that they're not going for the light switch. That's where they keep scraping their arm on it. Why did the fall happen? Maybe you haven't done the home assessment yet. You haven't moved the cords, moved the rugs, that kind of thing. So when something happens, hopefully if something happens, then take a second when it's appropriate, review what happened, because something in there can be changed. There's probably prevention methods that you can work on to not let it occur again.
So what I'm hearing from this is small changes can have a really big impact. And the biggest thing that we can do is when something happens, reflect on it, make some small changes, and prevent it for the next time.
Could not agree more. Transferring from a bed to a chair or back is a very common daily occurrence. We don't want folks to stay in bed all day. We don't want them to stay in the chair all day. So we should be moving back and forth. So let's talk about how to do it safely. The best position usually, if we're going from the bed to the chair, is to position the chair at a 45-degree angle to the bed. And if this is a wheelchair, which a lot of times it is, don't forget to lock the wheels. It's one of the most common things I see. If we're moving to a wheelchair, lock those wheels before we go to it. And even if it's a chair, make sure that chair is stable before we move to it. How do we support the person during that move? It says support core. We are not pulling on someone's arms. We're not using the shoulders. Our hands should be around the person's waist and back area, not those upper extremities, not the arms. I really like gait belts. There's a picture of a gait belt in a later slide we'll show you. Gait belts are great. You can put them on, take them off just for the transfer. I don't usually leave them on somebody. Gait belts give you a nice, firm, supportive way to guide someone's body weight. If someone is wearing maybe their pants that have a belt, sometimes a belt is as good as a gait belt, just a normal, regular, leather or cloth belt that they're wearing. You just want to make sure that whatever your hands are on is firm and it's not going to give too much. Waistbands work sometimes if it's a nice, tight-fitting pair of pants and it's not going to hurt the person to pull on the waistband. Some of them, elastic, if they're sweatpants and they're 20 years old and there's no elastic left in them, don't use that waistband to guide that person, because you might keep pulling on the pants and the pants might go with your hand, but not the person. Having your hands on a belt, a gait belt, a waistband. Sometimes I like to have a hand on each side of the person's hip if they're not a really large person, and a hand along the hip bones on each side can work well. You should be supporting at that level, around the waist, around the trunk, to guide their motion from the bed to the chair. You should not be doing all of the work. You should really only be guiding the person. If you're doing more than guiding them, then that's not really a safe transfer technique, and they might need to be using a mechanical lift, which we're going to show you and talk about later. It's really important to remember that we really should be giving no more than really a boost to maybe get them up to standing straight, and then we're guiding them. We're just helping them turn. We're helping them stick their rear end back as they sit down to sit nice and safely. That's the other thing we always talk about. Someone, when they sit, they should sit deep. We want them to stick that rear end back really far. Sometimes they try and sit really shallow, and you don't want someone to miss the chair they're going for and wind up on the floor. So really getting that nose forward and the rear end back puts them in a good sitting position to do a safe transfer like that. I also really like, you need to talk to the person, count it off. Say we're going to go on 3. 1, 2, 3, and you rock on the 1, rock on 2, and really go for it on 3. That is a practice that you want to establish with this person, right? You want to talk to them, you want to tell it to them, and you want to do it every time like that so that they get used to it. Counting it off and rocking is a really helpful tool. Smooth movements, don't jerk, don't pull. Smooth guiding motions is what we're going for. Let's talk about transfers in some other scenarios. Let's talk about bathroom safety first. Hopefully you have grab bars. If you don't have grab bars, you should try and put some grab bars in. Grab bars are lifesavers. They're phenomenal. Around the toilet, around the shower or the bath. If you don't, there are poles that you can install, that go like floor to ceiling that are kind of like a pseudo grab bar. They're helpful. The grab bars, if it's a possibility to install them, they are so worth it. Non-slip surfaces. Sometimes this means wearing shoes in the bathroom, and that might seem weird to the family member, the friend, the patient. Whatever gives us a non-slip surface is very important. If we're talking about actually in the bath or in the shower, we absolutely, of course, we need non-slip surface. You need the little stick-on, no-slip ducks kind of at the bottom, or a non-slip mat, or whatever version you have. We should not just have a stock, regular old floor tub or shower for these folks. If we're at a fall risk, we need non-slip surfaces everywhere around where that moisture is going to be. Raised toilet seats, they make transfers so helpful. Getting up from a low toilet seat is difficult. For folks who maybe have hip issues, they've broken a hip, maybe they have an old hip replacement, they shouldn't even be sitting on those to begin with. A raised toilet seat should just come as a birthday present with one of those birthdays at some point. It just should be a normal thing. So let's make that a normal thing. Raised toilet seats and grab bars are just absolute standards for bathroom safety. And I know everyone wants privacy, but this is the room where a lot of falls happen. You've got to find that fine line between respect for the individual and privacy, but we've got to be there to help them with these transfers, help in and out of the shower, off the toilet. These are practices you've got to get used to, and we got to get it out of the way so that this is normal, because bathrooms are where a lot of falls happen. Car transfers can be scary, but they don't have to be. The method that almost always works for me, you approach the car door, right? And maybe we're doing it with a walker, or maybe we're wheeling the person up in a wheelchair because maybe we're taking them to the hospital, and we all know how much walking that is. So maybe we just use the wheelchair just to save their energy. But you approach the car and you open that passenger door, and then we usually like them to kind of turn around and face us so that their back is to the vehicle. And when you sit in it, then a lot of times they like to reach up for that grab bar if you've got it in the vehicle. Sometimes you can hold the door and they can hold on to the door. You just got to make sure if you do that, that you really have that door. I like the grab bar a lot better. But what they should do is they should face you outside, have their back to the car, and they should sit deep. Remember, I talked earlier about sitting deep, that nose going forward and that rear end going far back. That's important with a vehicle because of the threshold of the door, that the seat is a little further away. So we want them to stick their rear end back there first to sit, and then their back should go back, and they should have something at that point to kind of hold on to so they feel good. And then you can help them, if needed, swing their legs up in once their rear end is safely on that seat. But that's how it should go when you're getting into the vehicle, right? Is that their rear end and their back should be there on a stable surface before you get the legs up in there. We want to avoid a lot of twisting. We don't want to put a lot of tension on their spine or on their joints. The most that should happen is really if we have to maybe help swivel their legs up. But as their legs go up, they should be moving with it. It shouldn't happen where we put a lot of twisting on the individual. They can swivel as their legs come up. It says consider that swivel cushion. We'll show you a picture later when we talk about equipment. But they make these little spinning discs for the right person. They're a great way to help transfer. And cars is where I tend to see it really well, because is they can sit on the swivel just like they can stand on it for other transfers. They can sit on it to swivel, so it can make decreasing the twist on the individual, it can decrease that a lot. And to get out, you just do it in reverse. So if you were going to get out of the car, swivel those legs out first, and then they would bring their back and their rear end out after. Let's talk about some of the helpful equipment that I've been hinting at this whole time. We'll just go left to right here. Slide sheets, some people call them draw sheets or transfer sheets. These are very helpful. Now, they do work best when you have two people helping and one patient or one family member, friend being moved by it. But slide sheets are great. The only thing I'd say is I like when the patient crosses her arm, just so that those arms don't get caught in anything. And you guys are able to gently slide the person up in bed maybe, or turn them 90 degrees so that you can start to help them sit up. But those slide sheets are really helpful for bed mobility. Transfer pulls, we talked about when I was talking about bathroom safety. If you can't install a grab bar, they're a great kind of improvised way to have something sturdy and stable in a position where a wall or something mounted isn't close by. Low friction sheets are a gimme. No one should get skin tears from turning over in bed. Sheets change, right? When we get older, let's get those low friction sheets. Mechanical lifts, when someone just cannot help with the transfers, then we don't want to put ourselves as caregivers in the hospital. We've spent all this time talking about our patients, our friends, our family members who we're doing the caregiving for. We got to watch out for us too. You can't lift everyone totally, all their body weight with your body. Sometimes mechanical lifts are needed. They do the work for you. So you would put a sling under the person and then clip the sling to this and let the machine do the work for you. They're lifesavers when you need them. Gait belts. I use gait belts every day, all day. Gait belts are great. They make them just like what you're looking at on the screen there. You can find some with a loop or two to give you a little handle. They are great. It's just a simple but very sturdy cloth belt that's adjustable. They make them for all body shapes and sizes. So there is one to fit the person that you're helping. We should all have gait belts in our home. Use a gait belt. Spinning discs are great too. You see someone standing on this. Sometimes if there's not a lot of room, it's nice to stand someone up and then we can just turn them and then have them sit down. So sometimes they're helpful for that. You can also imagine if I pick that up off the ground in this picture and I put it on a car seat, if that person lowered their rear end onto it and then I helped maybe with their legs because it swivels, then we could just turn them and they'd be sitting with their back in the back and their feet at the floorboard. So the spinning discs are great. These are some helpful pieces of equipment. Most of these are pretty inexpensive. You can also check with like your local organizations that might be around you. A lot of churches have durable medical equipment, DME. They call them DME lockers or a DME station where they loan this stuff out. Senior centers, stuff like that. You might have a local community organization that's able to help you with some of this stuff.
Tim, I think one of the things that I've learned the most working with caregivers is there's such a sense of fear when the process first begins, and especially fear builds after an accident has happened. But as you adjust to this and you help make transfers easier and safer, every single safe transfer is going to build on the trust, the dignity, and the quality of life. Probably the thing that I see the most is someone who is a caregiver wears their body down fast to the point that they may need care themselves. Can you talk about how important it is to care for your own body?
Someone who's in that caregiving situation, they do have to remember that if they are not taking care of themselves, then that situation, it falls apart completely. Now we're talking about we have to get caregivers for two people. What's going to happen? It completely blows up the plan. So you do have to take care of yourself. If you're a caregiver, if you don't take care of yourself, you're not going to be able to do that caregiving. We will talk about some preventative measures that you can take, and some of it is just being forward thinking too, right? If you're hurting yourself, don't keep doing that. What's going to happen? I mean, you can only do that so many times before it goes wrong. So you have to be smart. You have to make good decisions. You have to take care of yourself so that you can continue to do this really important caregiving that we're talking about doing.
So how exactly do they protect their body?
So like most things in life, stretching is important. We talked about range of motion. It's like an athletic event. Warming up is important. Stretching can be helpful before and after. This is just taking care of the machine that is our body. That's helpful for being preventative. Using proper mechanics when we're actually doing this caregiving, really important. lift. Lift with the legs, not the back. Everyone breaks this rule and then they got to go get help for themselves. Use your legs. And if you don't know what that is, many of us don't. I went to school for 7 years to learn about these body mechanics. If you don't know what good body mechanics are, maybe you're not in a manual, strenuous type job, and this is the first time you're really having to think about that, then you need to learn. Go find someone who can teach you. Maybe that's a doctor, maybe that's someone like me, maybe that's just friends and family who have lived through this, but learn good body mechanics and follow them. Because I tell you, 99 times you can use them. 1 time out of 100, you can use bad body mechanics and injure your back to the point where, you need surgery or something. Could be that drastic. So learn good body mechanics, practice good body mechanics. When you're doing something that you're unfamiliar with, it's okay to practice it. Those tools we talked about, they go a long way. The grab bars, the support poles, lifts when we need them, gait belts are a must. Things like the spinning discs can be helpful. Taking breaks at the bottom there, that's an important one. If you need a few minutes before you do another transfer because it's going to put your body at risk, that is important. That is valid. Take that break. Maybe you just need a mental break for a few minutes or longer. Call someone up. Hey, can you come sit with so-and-so for an hour? I just got to go walk around the block a couple times. Whatever it is, mental, physical. Caregiving is difficult. It's very difficult. Oftentimes, it's more difficult for the person going through it because there's emotions involved. Do what you need to take care of yourself. Because if that fails, then what is plan B? So you have got to take care of yourself.
I don't think we can emphasize this one enough. Self-care for caregivers is so important. You cannot pour from an empty cup. Learn how to care safely for your loved one and for you. This is a team effort. You are part of the team and you have to take care of you.
Understanding what's going on with these folks we're doing the caregiving for. The vision changes, the skin changes, the muscle changes. Understand that so you know the situation you're in. Learn these proper transfer methods like we've talked about so that you can practice that and follow through with it. Use those safe techniques. Don't be pulling on people's arms. Use the right equipment. Investing a little bit for the right equipment will help prevent more costly things down the road, right? So invest early on in that. An ounce of prevention is worth a lot. And then protect yourself. Take care of yourself. It is so important. We wanted to kind of close with that because of how important it is. Take care of yourself because without that, everything else falls apart. Help is out there. You probably need that help. Who and what can you go after? Physical therapy. I'm a physical therapist. We are movement experts. This is what we do. As our geriatric population grows, so do us. So does the number of us, the settings that you can utilize us in. You should at some point be interacting with a physical therapist. Maybe it is as a team with you and the person you're caregiving, or maybe even just you helping take care of you. But PTs and OTs, occupational therapists, also do a lot of this. We exist. We are in your neighborhoods. We're in your communities. So use us. This is literally our profession is designed around this. So we are there to help with all of the stuff we talked about today. The equipment fitting is really important. We've got DME suppliers. You should be using them to make sure that you are getting the right piece of equipment and it is fit right. But then PT and OT oftentimes comes in after that. No one gets a bike and then just starts doing it, right? So you get a walker, well, you need to learn how to use the walker. You get a cane, you need to learn how to use the cane. Wheelchair, same thing. So when you get some life-changing piece of equipment that's new, there should be a professional telling you how to use it safely. Otherwise, we're just, making our risk more. So make sure that you don't skip that step. And then family training, right? Professional instruction for caregivers. No one should be figuring this out on their own, especially if they're not confident, they don't have experience. You should be watching this and thinking about people in your life who can use this information to kind of jumpstart this new chapter, right? Get help, get training. There's all kinds of professionals like me out there who want to help you with this.
Tim, thank you so much for joining us today. It was wonderful information that I think people really need to know about. For those of you watching, Just Us Retirement does have some free resources available to you. So linked in the comments, we have our long-term care planning guide that you can download. We also have a private Facebook group, WV Medicare Questions. And then you can call us at Just Us Retirement, 681-340-1377 and book a free planning session to help you prepare for your own long-term care journey. Tim, how would people get a hold of you?
Very easy. If you're computer savvy, just go to fspt.org. So fspt.org, and there's a contact us. You certainly just give a Google search wherever you're at to physical therapy or First Settlement Physical Therapy, and we're probably right there as well.
Tim, thank you so much. I think I think this is a big step on helping people be better caregivers, and I really appreciate the time you took with us.
My pleasure. An ounce of prevention is worth so much. So please, for you folks who are watching, I appreciate you taking the time to do this. Let's take one step further and practice some of what you've heard. Reach out for some of these resources so that we can be better caregivers.
Yes. Thank you guys. Have a good day.